It's natural that we feel worried when there's a new threat to our health identified.
Dr. Deena Hinshaw held the title of Alberta Chief Medical Officer of Health for almost exactly 1 year before providing this update on a virus that had locked down an entire city in China and was spreading across the globe.
The risk to Albertans is currently very low.
A few short months later, everything changed. COVID-19 had arrived in Alberta.
And today I'm here to announce that the first presumptive case of COVID-19 has been detected in Alberta.
2 weeks later, Alberta's first COVID-19 death.
As heartbreaking as this news is, it was expected. This is a dangerous virus.
Under her guidance, Alberta implemented strict rules. Businesses closed, students were sent home, gatherings were prohibited. And these virtual COVID-19 updates became the norm.
Dr. Deena Hinshaw.
Dr. Hinshaw became something of a rock star, hailed for her calm demeanor, her focus on science, and her words of compassion for confused and anxious Albertans.
Now, more than ever, kindness matters.
Her face soon adorned T-shirts, along with other female health leaders like Doctors Theresa Tam and Bonnie Henry. But Hinshaw soon found herself fighting not only COVID-19, but politics too. As cases skyrocketed and vulnerable seniors in long-term care homes died in record numbers, a story was published using secretly recorded audio in which Hinshaw described an uphill battle working with then Premier Jason Kenney's government.
I am profoundly disappointed. This is a personal betrayal.
A third wave in spring 2021 would see measures reintroduced, but also the availability of safe and effective vaccines. On the tail end of that wave, a decision that would turn even the medical community against Alberta's top doctor, the Open for Summer plan, in which Dr. Hinshaw recommended dropping nearly all public health measures and ditching the main pillars of Alberta's COVID response: test, trace, and isolate.
I believe that this plan will work for Alberta, but it will take all of us.
Deena Hinshaw has lost the moral authority to be our public health leader. We want resignation.
As predicted, cases swelled again in September and October of 2021, pushing Alberta hospitals to the brink. As a last resort, the province introduced a vaccine passport to allow businesses to continue operating while alienating Albertans who chose not to get vaccinated. Record-high hospitalizations stretched into the new year before lower case counts finally allowed the province to lift restrictions in a phased approach. In June of 2022, Hinshaw's regular updates came to an end. While she made it through the worst of the pandemic with her job, Kenney did not. The UCP turned on its leader, due largely to his handling of the pandemic, and he resigned, paving the way for Danielle Smith, who immediately promised a healthcare overhaul.
I will be developing a new team of public health advisors.
Starting with the woman who was the face of Alberta's journey through COVID-19.